Pain. It's a pain. Physical pain can negatively impact your physical health, psychological health, and can even impact your cancer treatment and cancer treatment options. I'm cancer physical therapist Dr. Leslie Walke. Welcome to the Recovery Room. In this episode, we are talking about pain. Yes, pain is a pain. It can contribute to depression and anxiety. It can worsen fatigue. It can be a reminder that you have or had cancer. Pain can impair your appetite, daily function, your work function, and overall quality of life. If you have completed treatment for a stage 0 through 3 cancer of any kind and are still having pain months or years later that is not related to either chemotherapy-induced peripheral neuropathy or from taking an aromatase inhibitor, the pain could very well likely be due to leftover issues from surgery or radiation. In this case, please have your doc or nurse get you back to PT. Even if it is months or years later, this type of pain can be lessened or eliminated. Also, get back to a PT if your strength has not fully returned to normal. If you have been treated for a stage 0 through 3 cancer, having long-term pain and weakness should be a rarity, so please have it addressed. For people with stage 4 cancer, aka metastatic cancer, things are a bit more complicated when it comes to pain. If you are living with metastatic cancer and have intermittent or continuous pain, here are a few considerations. Thing to do, number 1, is to figure out where the pain is coming from. Is it a run-of-the-mill bone or joint problem like tendonitis or arthritis? If so, get it looked at and addressed by an orthopedic doc or PT. If the pain is from current cancer treatment like neuropathy from chemotherapy or joint pain from an aromatase inhibitor, work with your doc and PT to help improve it. If the cancer itself is irritating a bone, organ, or nerve, chances are your medical team is already addressing it with some type of treatment. And just like people with stage 0 through 3 cancers, if you have residual leftover pain from surgery or radiation, please have it addressed. Thing to do, number 2. Once the source of the pain is identified, figure out what can be done about the pain you are having. And that may be one of 3 things. Option A, fix the problem and the pain gets better. For example, you are having pain because of an infection. You take an antibiotic and the pain goes away. Or you are having spine or hip pain due to bone metastasis and you have radiation to shrink the tumor and the pain in the area stops. Option B, mask the pain with medication. For example, if you are having neuropathy, nerve or bone pain that can't be fixed, different medications may be available to mask the pain. Yes, I know, most people don't like swallowing a bunch of pills. However, being a martyr and fighting through pain doesn't get you any bonus points. It just gets you more pain. If prescribed medications can make the difference between you being miserable or less miserable, don't be a martyr and take the meds. Thing to do, number 3. Figure out where to get help. Cancer doctors and nurses are some of the most awesome and caring people on the planet. Yet, if you feel like you are not being heard or not getting the resolution you are wanting, check with your pharmacist, another doc on your team, or ask for a referral to a pain doctor or palliative care specialist. Thing to do, number 4. If you're stuck with the pain, find ways to still stay safe and stay active. Discuss with your physician your specific limitations and then find safe and creative ways to get around those limitations. Learn if activity is going to make it better, make it worse, or have no impact on it at all. For example, will a back brace help your hip or back? Will a cane help your pelvis pain? Or will a walker help you walk further, faster, and safer with the same amount of pain? If so, go for it. And finally, I want to share with you the American Pain Foundation's Patients' Pain Bill of Rights. And I quote, "As a person with pain, you have the right to have your pain taken seriously and to be treated with dignity and respect by doctors, nurses, pharmacists, and other healthcare professionals. You have the right to have your pain thoroughly assessed and promptly treated. You have the right to be informed by your healthcare provider about the possible causes of your pain and the possible treatments, including the benefits, risks, and costs of each. You have the right to participate actively in decisions about how to manage your pain. You have the right to have your pain reassessed regularly and your treatment adjusted if your pain has not been eased. You have the right to be referred to a pain specialist if your pain persists. You have the right to get clear and prompt answers to your questions, take time to make decisions, and refuse a particular type of treatment, if you so choose. Just because you have stage 4 cancer doesn't mean you don't deserve to be as pain-free and as healthy and as strong as possible. Keeping yourself strong and feeling good will help you sleep better, eat better, tolerate treatment better, exercise better, and live better. I'm Dr. Leslie Walke, signing out from the Recovery Room. Let's talk again soon.